There's been some dispute. Good evening, by the way. Should wear seatbelts tonight because we're going to be on quite a ride over the next day or so, and I'll see what I can do to enlighten us about that prospect. One of the issues is whether what we have before us is Ryan care, the Speaker of the House, or Trump care. But Donald Trump has now, in a number of times, said, "I'm 100% behind this." So he's taking ownership entirely of this process, although I dare say he doesn't really know much about what's in it, other than the desire to make it happen. As baseline, what this table shows are the number of seats that the President's party, or of these 9 first-term presidents, had in the House of Representatives. And the next column, what I call solid votes, are the number of votes that you would get on average in those years based on how often those party members stuck together on votes. And what you see is that the Republican majority in the House, which is actually a little smaller than 241, there's some vacancies, is not an astonishing large majority, but they have been sticking together pretty well over the last several years. And so there is a working Republican majority in the House, and one that's quite ideologically coherent, which is why when I was here 2 months ago, I fully expected the House to enact whatever the Speaker was going to come up with. If you look on the Senate side, you also see that the Republican majority of 52 in the Senate is a really very small and narrow majority compared to these other past presidents. And when you look at how often they stick together on average, they really do not have a working even majority in the Senate, much less a supermajority. And just to recall that when President Obama was able to enact the Affordable Care Act, in a sense by the skin of his chinny chin chin at the time, it was with considerably better numbers in the Senate than Republicans have right now. And what President Trump is confronting, Republicans are confronting, is to actually even just get the majority on the reconciliation bill will require a level of unity that they have not achieved on average at any time in the past. So we'll see how well that works out. And of course, when it comes to having to pass something over a filibuster outside of reconciliation, it requires 60 votes. And I'll talk a little bit about the significance of that. This is Speaker Paul Ryan, and he's presenting to the press the overall, what he called, three-pronged strategy for how they wanted to repeal and replace Obamacare. The first is through this reconciliation process that Jerry talked about. Reconciliation, as Jerry mentioned, provides protection in the Senate. You may not filibuster a reconciliation bill, and therefore you only need a simple majority, so you only need what would turn out to be 50 votes in the Senate because Vice President Mike Pence can cast the deciding vote. But the problem with reconciliation, as Jerry mentioned, is you can't include everything in it. It can only be measures that are directly related to revenues or expenditures, and under the so-called Byrd rule, any other provision can be presented as out of order on the Senate floor and bring the whole thing to a stop. And so the Republicans had to be very cautious about what they put in the reconciliation bill because it could simply be blocked in the Senate by putting in things that could be challenged. The second part of the prong is what they call administrative action. Here, Secretary of Health and Human Services Tom Price has promised that the department would do all kinds of things to stabilize the health insurance market following the enactment of the American Health Care Act, and that would allow them to move on to the third prong, which is what is here presented as additional information, additional legislation. And additional legislation is to capture all the things that they can't do in the reconciliation bill. And that's going to get very complicated, as I'll talk about in a moment. And I should say that even on the reconciliation, there are complications, as I'm going to mention a bit more in a moment. The Freedom Caucus has about 30 members, most of whom have indicated that they're going to vote no tomorrow if it comes up. And in the Senate, there are 3 senators, Cruz, Lee, and Paul, who've already said they're against the bill because they identify the bill as an overly expansive Obamacare-light entitlement program. When you come to the additional legislation, the trick here, of course, is if they're going to pass something, they're going to need all 52 senators plus 8 Democrats, at least 8 Democrats. And they want to get those Democrats to support things like getting rid of essential benefits requirements, to get rid of the preventive care coverage without a copay, and to get things like opening up plan competition across state lines, which is, we can go into this later, a particularly unlikely prospect for working in the health insurance system. Now, one of the complaints that Secretary Price has is CBO, the Congressional Budget Office, has been scoring the reconciliation bill, but not these 2 other things. And of course, CBO can't score them because they don't exist. There's nothing to calculate costs around, and so those have not been part of the discussion yet. Okay. CBO on March 13th did issue its scoring of the original version of the American Health Care Act, and my understanding is sometime tonight they are going to issue their recalculation and scoring of the new version as Jerry discussed it. And of course others have also been trying to ascertain what the impact would be of the American Health Care Act if it were to be passed into law. The first thing that is very well known is what Jerry and others have already mentioned, which is quite immediately there would be an expansion of about 14 million uninsured in the first year, then up to 24 million uninsured, or what Paul Ryan has described as freedom. It is a significant and dramatic shift, and of course this has many moderates in Congress, including the Republican Party, quite worried. The increases in the uninsured come from ending the individual mandate, the tax penalty, come from ending the mandate on large employers, come from reductions in the subsidies through the tax credits, which will mean fewer people will be able to afford insurance and therefore won't take up the tax credit. But the big bulk comes from Medicaid, and as you can see, the increase in the uninsured in Medicaid is dramatic, large, and persistent as we go forward. Now, it does save money, the American Health Care Act. It will reduce the budget deficit by $337 billion in the scoring, although that's going to actually disappear pretty soon because the change has been made in the bill. What happens is they are reducing expenditures by $1.2 trillion in the bill, but reducing revenues by $883 billion. And just to give you a sense of where that money is, most of the revenue savings are actually going, as Jerry mentioned, to the more affluent. In fact, the one analysis I read suggested that about 60% of the revenue savings from the first two categories up there go to millionaires. So this is a significant redistribution back to the top. And then, of course, the major reductions are primarily in the almost $900 billion cuts in the Medicaid program. One of the things about these tax credits as opposed to the subsidies, as Jerry mentioned, because it's based only on age, not on income or location, means that if you're low income, the net premium you're going to have to pay for coverage, particularly as you get older, would be much higher under this new bill. And if you are quite wealthy, it means you have to pay considerably less in net premiums as a result of passage of the act if it happens. This is the distribution of the impact on changing from the ACA subsidies to the tax credits. And a couple of things to highlight. First of all, it's pretty good for more affluent young. Now, the fact that these folks tend to vote more Democratic is kind of an interesting political strategy on their part, but as long as you're not a poor 27-year-old, you do quite well. The next thing to notice is you do quite well, as Jerry mentioned, the higher you go up you go in the income spectrum. Quite interestingly, one place that does really well is Santa Monica. So I'm sure that's a relief to all of you. The average increase in Santa Monica in the tax provision for you would be $6,000. So this is a good benefit for us out here in the west side of LA. Not so good if you are in the pre-Medicare age group and not tremendously wealthy. This is really where you take a significant hit, although this is where changes in the bill. There's supposed to be something like $150 billion, I've heard, that the Senate is then supposed to decide how it goes to help support people who are in the more later years in life and don't have a lot of money. Okay, you can also, I'll go through this very quickly, that's a map of the United States. The red states have two Republican senators. The blue states have two Democratic senators, purple, one Democrat, one Republican, and the stripes are the independents, but of course the independents are caucusing with the Democrats. Just to give you a sense of what this looks like, a 27-year-old earns $20,000 a year is not going to do well. And that's going to be true across the country, including Republican states. A 40-year-old earns $30,000 a year, better, but you can still see there are a lot of areas where people are going to do worse. That's the blue under the new act, if it's enacted. If you're a 60-year-old at $20,000, almost all across the country people do worse. If you even earn $40,000, still all across the country, including in Republican states with Republican governors. So overall, the so-called red states, the Republican states, on average do worse under this act than they do under the ACA. Now, This is done by Nate Cohn at the Upshot at the New York Times. It could be prone to a lot of measurement error and what we call ecological fallacy, but he tried to calculate based on survey data from the Cooperative Congressional Election Study and the Kaiser Family Foundation's calculations of the tax credit impacts, who would be affected. And what you see is at the top, that has to do with buying in the individual insurance market, and you see the top 4 losing groups are either more likely to have supported Trump than not, or just about even. And of the Medicaid beneficiaries, it's a little bit hedged. Trump supporters are more likely to be in states that are also going to be damaged by the American Health Care Act. So it actually is in many ways targeting their own constituency, just to make that highlighted. Now, this is the Medicaid expansion states, 31 states plus the District of Columbia. These are the Republican expansion states, and by Republican I mean they currently have Republican governors who are really on a day-to-day basis responsible for what happens in their states and how one has to manage the system. These 4 states, their governors actually wrote letters to Speaker Ryan and Senate Majority Leader Mitch McConnell indicating their opposition to the American Health Care Act, and they've also written to their congressional delegations. This shows you the number of Republican senators who are in the expansion states, a considerable number, so this is something they're going to really have to think about if the issue moves on to the Senate. These are the vulnerable Democrats, the most vulnerable Democrats, and there are some, so that might go on the other side, although so far the 10 most vulnerable Democrats, 10 come from states up in the next election that Trump carried, are all in uniform opposition to this act. So they're not going to be easy pickings for the Republicans. And then 3 other things blowing against the political dynamics for the American Health Care Act. These are the groups in opposition, a whole bunch of liberal groups, but also, as was already mentioned by Alexander, the AARP and Families USA. Basically all the healthcare industry
pretty much
are in opposition, from the docs to the nurses to the hospitals to the Catholic Hospital Association to the nursing homes. And the right-wing parties, the right-wing organizations, Freedom Caucus, Tea Party, Club of Growth, Cato Institute, and Heritage Foundation. So that's a pretty good coalition if it's not against you. A second thing that's, I'll be wrapping up very quickly. Second thing that is pushing against is these are the latest Donald Trump numbers, not quite the latest, from a couple of days ago. That top line is not his approval rating, that's his disapproval. Trump made history by hitting the 50% mark in 8 days, compared to hundreds of days and over thousands of days. And it's actually hovered around where it is right now. Now, if you're a Republican senator, you're looking at that and realizing there's not a lot of political juice behind the president right now, which is why his work with the House Republicans has not had huge impact. On the other hand, you have to realize the president still has support of 86% of Republicans. So if you're thinking about your Republican base and not wanting to be primaried, as they say, that's an issue. On the other hand, if you're worried about the general election, the president's approval among independents is at 35%. For Democrats, it's around 10%. So the third thing, which I don't have up here, but I showed last time, is in fact the Affordable Care Act has achieved a greater level of popularity and support today than it's had since it was enacted.
That's correct.
I think as the stories that come out of what people experience. So tomorrow we go to the House, maybe. They may pull the bill, because right now CNN in the count has at least 27 Republicans. They can lose 21, has 27 Republicans saying no. The New York Times latest count has 27 plus another dozens or so who are leaning negative or are very much undecided. So it's really up in the air. And then there's the Senate. The Senate plays into the House. There's something called being BTU'd. In 1993, when President Clinton had his Budget Act, he wanted to tax British thermal units as an energy savings provision. And the House, after a lot of arm twisting, went along with it. The Senate then did not. So all those House members who went out on a limb and had a vote on a hard issue eventually got really politically tarred as a result. So nobody in the House today wants to be BTU'd. And they're worried about it. The Senate's not going to act. Why would I go forward? Now, the Senate, we have no idea when or how or what. I'm going to tell you right now, or at least I'm going to suggest to you right now, I will be the UCLA optimist for those of you who want to see the ACA continue. I think it's going to continue. I don't think they've got the traction to go forward. And if the Republicans are unable to get a successful vote in the House, it's going to be really quite extraordinary in its impact on what the President and Republicans can do at that stage. So thank you very much.